Hi, this is Sagar Wagle, one of the musculoskeletal radiology fellows at Stanford University. A 58-year-old male with recurrent hemoptysis during open water triathlon events was diagnosed with swimming-induced pulmonary edema. While there are no specific imaging findings for swimming-induced pulmonary edema, let's look at some cases for pulmonary edema. Pulmonary edema can happen due to volume overload, for example, in cases of heart failure or renal failure, or they can happen due to endothelial dysfunction of blood vessels in the lungs, which have a lot of causes. A couple of them include drug toxicity or high altitude pulmonary edema. In volume overload, the heart tends to get enlarged. Compare the size of this heart with the size of the heart on the right. In volume overload, the azygos vein also gets enlarged. Azygos vein comes up in a paraspinal location, and in the groove between the trachea and the right mainstem bronchus, the azygos vein comes anteriorly to meet the superior vena cava. Compare the case on the left to case on the right. In the groove between the trachea and the right mainstem bronchus, we don't even see a azygos vein here. There are bilateral pleural effusions, which is a finding for pulmonary edema. Look at the claustrophrenic angle on the normal case on the right and see how we don't see the claustrophrenic angle in the left. That's due to pleural effusion. The pulmonary airspace opacity has this perihilar appearance, which is called bat wing pattern of pulmonary edema. At times, it can be difficult to tell pulmonary edema apart from other causes such as pneumonia or aspiration, and one way to tell them apart is if you diurese the patient, pulmonary edema can go away in imaging as quickly as 12 hours or a day. Pneumonia takes 8 to 12 weeks to go away on radiograph, and aspiration also usually takes longer than a day to go away. So if you diurese the patient feels a lot better and the imaging abnormality goes away. That's one way to tell that it's pulmonary edema. In this case of pulmonary edema, we see that the heart is enlarged. We also see cephalization of blood vessel. Cephalization of blood vessel means that the blood vessels in the upper lungs are enlarged. Look at this blood vessel. Look at this blood vessel. Look at this blood vessel, this blood vessel, this blood vessel, this blood vessel, and compare it to the blood vessel on the right image. See how skinny these blood vessels are. So cephalization on the left is a finding of volume overload. These horizontal lines are called Curdy B lines, and Curdy B lines are also seen in pulmonary edema. The airspace opacity in this case has a bibasilar distribution. In this case of pulmonary edema, we see bilateral pleural effusions. The cardiac silhouette is obscured, and there's this diffuse hazy bilateral pulmonary opacities. In this case of pulmonary edema on the left, on the CT, the heart is enlarged. Compare that to the heart on the right. And these thickened pulmonary septa, this is what we see as Curdy B lines in radiograph. That's all for pulmonary edema. Thank you for watching the video.